Oh my god, he was alright till now. What is happening to him? Let me call the doctor. Doctor, my dad is shivering and is not able to breathe. Please check what's wrong.
This is happening due to blood infection. Your father is suffering from sepsis, which is critical and needs admission into the ICU immediately for continuous monitoring. We have started the standard care of therapy and will observe for 24 hours. It's been over 24 hours and your father's condition is still quite critical. His vitals and hemodynamic parameters are not stable yet.
Why is it so?
Sepsis is a critical illness which needs to be treated with multi-modal approach. Let me make you understand how sepsis usually progresses. Sepsis is the condition or syndrome caused by the presence of microorganisms or their toxins in the tissue or bloodstream. Sepsis enters our body through different sites. Once inside the body, the bacteria starts to multiply and then it begins spreading into the bloodstream. Bacteria releases endotoxins. White blood cells react to the presence of bacteria and release inflammatory substances called as cytokines. The combination of bacteria releasing endotoxins and WBC releasing cytokines leading to life-threatening organ dysfunction is referred to as sepsis. Excess cytokines causes leakage of blood vessels, causing low blood pressure, which severely affects organ systems. This is called as septic shock. Sepsis can be treated with antibiotics, IV fluids, vasopressors and other supportive measures. But some patients may not respond to the above standard care of therapy, and this patient may need newer modality of supportive treatment to prevent patient progression to multi-organ failure.
Why multi-organ failure occurs in sepsis patient?
In some sepsis patients, the excess release of cytokines is difficult to control. The excess release of cytokines is known as cytokine storm. The cytokine storm restricts them to respond to standard care of therapy, leading to organ failure. Uncontrolled cytokine storm can cause blood vessel leak, clotting in the blood vessels, which may further lead to organ dysfunction. As your dad is not responding to standard care of therapy, we are suspecting cytokine storm, which needs to be addressed through extracorporeal therapy like cytosorb.
What is cytosorb?
Cytosorb is an extracorporeal device which absorbs cytokine and helps in management of cytokine storm. Cytosorb consists of polymer beads which absorbs cytokines between 10 to 55 kilodalton molecular weight by forming ionic bonds while blood passing through the device.
How is cytosorb connected?
Cytosorb is connected through the dialysis machine. Blood flows through the device and back to the patient.
How is cytosorb different from other extracorporeal therapies?
Membrane filter works on filtration, whereas cytosorb works on the principles of adsorption. It has a large surface area of porous beads which helps in removing excess cytokines, effectively varying from sizes of 10 to 55 kilodalton.
What benefit would cytosorb give to my dad?
Cytosorb would help control his situation by reducing the vasopressor need and stabilizing his hemodynamic parameters by arresting the damage caused by the cytokine storm. Cytosorb device would address the cytokine storm. Proper control of cytokine storm would minimize the risk of damage and multi-organ failure that could happen to your dad if not treated at the right time.
How many times should cytosorb be used for dad? Would there be any side effects associated with it?
It depends upon the patient condition and severity of illness. The side effects may be minimal, as seen in dialysis procedure.
I feel quite relieved after knowing about cytosorb. I believe it would be the right treatment option for my dad in this situation.
Don't worry, dear. I'm sure your dad will get well soon. Your decision is crucial in choosing the right treatment at the right time for better outcome.